this meeting to order. Please rise for the Pledge of Allegiance. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Amy, could you please read the open public meeting statement?
Adequate notice of this meeting of the Township Council of the Township of Roxbury was given as required by the Open Public Meetings Act as follows. On December 31st, 2024, notice was emailed and faxed to the Daily Record, the North Star Ledger, the West Morris Recorder, and published in the Daily Record. Notice shall also remain posted throughout the year on the bulletin board in the main hallway of the municipal building.
Thank you. Roll call.
Councilwoman Albrecht. Here. Councilman Carey.
Here.
Deputy Mayor Crowley.
Here.
Councilman DiFilippo.
Here.
Councilman Hall.
Here.
Councilman Riley.
Here.
Mayor Patillo.
Here. This brings us to presentations award, etc. Hello, Anthony.
How are you?
Nice to see you again.
Likewise.
Michael, how are you? Dolly, do you want to start?
Yes, let's start. So, as you all know, the state health benefits program is going up another 36% this year. And it's becoming unsustainable, not only for the township, but also for the employees who are having to contribute a portion of their salaries. So we were tasked with going out to check what was out there in the sector for us. And obviously we looked at and spoke to the New Jersey HIP, which in your packet, their proposal is included. And then we also spoke to Anthony Soma from Nova. And he gave us a very good proposal. He's been very attentive. He's asked many questions, he's answered all the questions that we've asked. We have taken some of the information to our liability risk manager who has reviewed it. We've also had an outside risk manager who's reviewed it. We've gotten mostly positive feedback, but obviously, some things to look at. And we've also gone to our unions. We've had Anthony meet with all of our unions. Everything has been mostly favorable from them. A few questions, but not anything that is standing out. As you can see from the proposal and what he'll present, everything he's offering is equal to or better than what we already have. It is, however, leaving the Horizon Blue Cross network and going to Aetna, which we've done before, because when we were in HIP, we were in Aetna. He shared with us the links to the doctor network, and everybody's been able to, check to see if the doctors are in there and everything. So we're at the point now where we wanted to bring Anthony to you, so he can present his program to you. If you could have had any questions, you could ask him questions now. He's here for that. So with further ado, I'd like to introduce Anthony and Mike Crispy.
Thank you. Yeah, it's been an interesting and I believe very productive last 3 months working with Valerie and the rest of the team to put together a proposal for you for the health benefits. What I usually like to do is start with a little bit of brief education on benefits, because I know you all are not working with benefits every day like I am. It's a complicated subject, and so I figure kind of laying out what our model is, how it's different than what you're currently in, how it's different than the HIP, how it's different than other options, and then going into the details in the proposal is really the best way to go about this. Obviously, ask me questions, interrupt me as I go through the proposal. What you have in front of you is a copy of several documents I've provided to the township. Some of it's a proposal, some of it's a stop-loss proposal. A lot of it just detailing the overall offering in our services as well. So it's kind of hard to see up there. It's a little bright. Oh, there we go. That's better. Before getting into this, the company I'm with is Novo Connection. We're headquartered in Denver, Colorado, but we have clients in 40 different states, members in all 50 states, including DC, including New Jersey, and we have about 300 clients. We specialize, though, in public sector. So about a third of those clients are municipalities, counties, school boards, even higher education institutions, and we even serve the Nebraska State Association of Law Enforcement, which is about 3,000 police officers. So we're very experienced. What do you have locally? Oh, locally? So public sector, no one yet, but as far as nonprofits, we do serve a very well-known charter school out of Newark, that would be Great Oaks. And we also have some private business, in the mix of our clients. Now, the model itself is if you look at this chart here, you're looking at basically what the industry is. On the left side, you're looking at fully insured, which is how you would describe the state health benefit plan and the HIF. It's a fully integrated model. You're paying fixed premiums, they don't change, and you have very limited access to reporting. The issue with that is that you don't really know what's happening with your health plan. You might get monthly claims reports, you might get some very broad pharmacy reports, but you don't know what the claims are, you don't know what the specific drugs are, you don't know who is sick with what, and without knowing what's driving those claims, you really have absolutely no control. You're really at the behest of whatever model you happen to be in, whether it's a state plan or fully insured from a big carrier. And so with the lack of flexibility and the lack of visibility, it's almost impossible to truly control your spend over time. This is why we're seeing, especially in the public sector, 30% increases, 20% increases. It just keeps piling on because there is no flexibility within this current arrangements. We sit on the total opposite end of that, which is called the fully unbundled model. Now, when you're fully insured, all these different components, the third-party administrator, which pays the claims, the pharmacy benefit manager, which manages the pharmacy plan, the stop-loss reinsurance, and any other components of the plan that you might include, are all packaged into that single fully insured model. With us, we're able to customize every single component of the plan. So we can match you with the best TPA and the best network, which in our recommendation here is Aetna, and we're using the fully owned Aetna TPA, which is Meritain Health. So you're getting access to a fully owned network, direct access, and then Meritain is able to mirror everything with the state plan as they also are currently in offering. With the PBM, we work with transparent pharmacy benefit managers, so we're able to drive savings in that sense. I'll get into more detail on that. But essentially, this is where you want to be. If you can get to the partially self-funded section, which is all the way to the right, you're going to know what's happening with the plan, and you're going to have the ability to have a substantial impact on the spend, but more importantly, the healthcare outcomes for your members. Because, and this is critical to understand, it really isn't about, you're not looking to cut coverages, you're not looking to try to reduce anything for your members. The goal is to enhance what you're offering and to source drugs at a better price to provide more access to healthcare for your members, because that's how you're going to overall, reduce spend by getting people healthier sooner. Us as a company, a couple important things to know. Fully transparent, so all our fees, all our vendor contracts, everything is available to you to review. We are completely independent in the sense that we take no compensation from any of our partners. So we get paid a single program fee, we get paid a percent rate off the stop loss that we procure. Everything else is a pass-through cost from the TPA to PBM or whatever other component that's included. Again, big difference compared to the state health benefit plan, compared to the HIFs, compared to the large insurance carriers and their fully insured models. And then we're able to provide, as far as service support, think of us really as a co-administrator. We're providing analytics, we're providing account management, and we're providing employee engagement services as needed for all of our clients and their employees. To give you a look at how we perform, what you're looking at here is, and this is compared to the industry average, which is 10% increases, 7 to 10%, you could say. Our average client runs at about a 2.2% annual renewal increase. Usually in that first year, we do see about an 8% reduction. Now, depending on the plan, depending on how inefficient your current arrangement is, it can be more substantial, like in this case, which, I'll show you the numbers that we have for you. But if you think about the state plan, if you think about the HIFs, you think about public sector, it's not a 10% increase. You're basically at a hockey stick looking at 10 to 20 to 30% increases. So those gray bars don't even really give you an idea of how substantial that difference is. We have a commitment to transparency. This is just stating that and our commitment to supporting you. And then, so we're also an award-winning program manager. So Berkeley Accident is Health is owned by W.R. Berkeley & Co. They're a Fortune 100 company. They've been around for 100 years. A-rated carrier. We consistently receive awards from them, and this is just a mention of 3 awards we won within the last year for our clients, but every year we're acknowledged for our outcomes and for our clients' performance. A couple other things. So why we exist is because when you peel behind fully insured and estate plan and all these fixed arrangements, what you see is a lot of conflicts of interest in the industry. You have, vendors making, let's take pharmacy benefit managers, for example, making a cut off of the manufacturer's rebates that should be going 100% to the client, in this case, the township. They're also designing the formulary, which is the list of approved drugs. They're doing the clinical review, so they're able to rubber stamp all these expensive drugs to be approved and provided to the employees. And then in many cases, they're also funneling the actual fulfillment of the highest cost specialty drugs, which might be as high as 100, 200, 300,000 a year, through their own pharmacy, where they're also taking a profit margin off of selling those drugs. Optum does this, ESI does this, CVS does this. All of the big carriers that control about 80% of the market essentially steer members toward drugs that are not necessarily fit for them because of the financial incentives in place. It's the same thing, you see that in a number of different ways in other parts of the industry, but it's really bad on the PBM side. So what we're doing is we're taking the data that we're gonna get next year, should you become a client. We're gonna be doing automatic analysis in real time and repricing of the claims. So we have a full technology platform, which is gonna be looking at our top programs, and even at the most basic level, if you think about the networks and the TPAs, we have all the major networks loaded into this platform. We're able to reprice the claims in real time. So we can tell you, as a matter of fact, next year, if Aetna is the network you want to remain on, or if United might be better, Cigna might be better. If you might want to be adventurous and look at reference-based pricing, all of that we'll be able to do for you with our system. And you're not able to do this now because, again, you're not getting the actual claims data from the state plan. If you were to consider, I know Valerie mentioned the HIF, there's no data access there as well. I'm actually working with some groups that have been fighting for about 6 months to try to get their data, and they won't provide it. And with us, let's say if you wanted to leave after a year, you own that data, you take that data with you, you have full flexibility to shop around. One other thing, so I mentioned the pharmacy. Our pharmacy program is cutting right to the core of what's wrong with the system. This is a lot of moving parts. If you're not an insurance person, this might be a little confusing. To put it simply, we're offering a broader formulary through a transparent PBM, which is Prime Therapeutics. So your members are gonna have access to more drugs. They're still gonna have access to the high-cost specialty drugs if necessary, but they're also gonna have more generic options and other lower-cost brand name drugs, so that prescribers, their doctors, can actually have more flexibility to provide something that's really fit for them. Because what you also find too is that if you're steered into a limited offering, you might be prescribed a drug that's covered by the plan, but that actually might not be fit for you genetically. So you may have worse adverse effects. You might become, it's just a poorer experience, or you might not get the proper healthcare outcome that you could if you were matched up with the right drug. Yes?
Proprietary generics, is that what this is? Proprietary generics?
I mean, some of them are proprietary, some of them are brand name. This is just, I mean, there's so many different manufacturers out there, so we're looking at everything.
It's not just one manufacturer.
Oh, no, this is the entire market. Yeah, so we're expanding the formulary, which is just a list of drugs that are covered for more access. The rebate submission, so I mentioned before how these PBMs are taking a cut of the rebates. We actually are a rebate aggregator for smaller PBMs, which means we have a direct relationship with the rebate called wholesale. So with us, you are avoiding that cut. The PBM doesn't take any of that money, which belongs to the township, and instead we're sourcing it directly for you, which means we're also able to validate it more accurately. And then we have the independent clinical review. So it's not a PBM rubber stamping a drug. It is a team that is looking at the medical need and is focused more on what drugs are on the plan and what should actually be approved, as opposed to what's going to drive drive costs. So that's the overall program at a high level. Now I'm going to simplify it and slow it down. What we did here was we matched all the same plan designs to make sure it's equal to or better. We are recommending the Aetna network, in part because I know from personal experience, I've seen with other clients, that the Aetna network has better discounts. There's more providers and hospitals covered. And if you look at most of the public sector groups that have left the state plan, and I know Valerie mentioned the HIP as well, they tend to overwhelmingly go to the Aetna network. It's a better network, tried and true tested. Meritain Health is the third-party administrator which will be processing the claims. They're fully owned by Aetna. It's how you get access to the network. Front Therapeutics, I mentioned them. So you know they're also wholly owned by the 19 independent Blue Cross Blue Shield companies. And then the stop loss, we are recommending Exchange Benefits, which is the wholesaler, and then US Fire is the paper that is underwriting the actual proposal. And then we have a United Healthcare Medicare Advantage quote for your Medicare qualified or Medicare eligible employees and their spouses. To get into the financials, still a bit hard to see up there. The stop loss coverage is, and you have a more detailed copy of this in front of you. As I mentioned, Exchange and US Fire, Meritain Novo for the co-administrators. Your current cost, if we break this down by active employees and non-Medicare employees, is $5.6 million for that group. That's what Novo will cover with our program. Our quote on the maximum cost, because with self-funded you can actually run lower than the maximum, is a $4.5 million total maximum liability. Yes.
Where's that slide that we have?
It's not the slide, it's going to be, let me just pull it up.
I got it.
Okay. Sure. Yeah, the document you have is going to be more detailed, so this is the high level. So the max cost for the actives and non-Medicare retirees, you're looking at a 20% reduction. Part of that is because you're moving from fully insured to self-funded, so there's what we call a claims lag. In the first 30 to 60 days, you're really not going to be paying a lot of claims, so it's going to look like basically a little drop. By March, you'll start to be paying all of the claims because you'll be through the lag. That's about a 10% or so, we call it load, which is generally an increase you might see in the second year. Part of that depends on what your actual claims end up being. Part of it depends on what kind of steps you take the next year. But that puts the 19.8% reduction, I think, in much better context. You've also got to consider with the state plan, it's extremely inefficient, and they are trying to refill a fully depleted claims reserve. So you're talking about years and years of spending that was never accounted for, that a lot of this 36% increase is actually about. And to give you some anecdotal, consideration, other towns I've been working with, the worst I've seen coming out of the state plan has been a 5% increase on max. So that tells you right there that this 36% increase is totally unwarranted. It's part of, I guess you could say, New Jersey politics. And where we're putting you is, yeah, it can't be, right? But yeah, we're putting you on a much firmer and transparent footing. We're driving a lot of the savings with that. Now the Medicare Advantage, we count about 104 members there. That's fully insured product through United Healthcare. That is a passive PPO, which means you can go to any doctor in the country. Every doctor that takes Medicare is essentially in network. We fully match the plan design. And that comes to, with that enrollment, about 720,000 for the year, for a total cost of about 5.2 million. Now this can vary depending on headcount. If you hire 20 people, the numbers might change. Same thing if you fire 20 people.
Look at you, Joe.
Yeah. So if you take the total current cost, which is about 6.4 million, you look at the total anticipated maximum cost, it's a savings of just under 1.3 million with our proposal, which is obviously substantial. And this is a starting point.
So where's the risk in the self-insurance?
Well, since we have stop loss in there, there's very little risk. The most risk you'll run into is at renewal if you don't have a plan and you don't have options. And that's kind of the same as what you're in right now with the state plan or any other fully insured model, where you don't have ways of enhancing the plan, and a lot of it's about plan enhancements, like sourcing drugs at a lower cost. Another example dealt with recently, ESRD, so somebody with end-stage renal, it's $300,000 a year. If you are in the state plan, you do not have the ability to implement like a dialysis PPO or a Samaritan fund to offset that cost and help that member. So what we're gonna do is, we're gonna make recommendations ongoing, quarterly basis. We're gonna look at all these high-cost claimants, we're gonna look at the drugs, and then we're gonna identify the opportunities where we can, like I said, source them better, provide better coverages, or somehow offset the financial risk that you're facing. Generally, I mean, Our groups usually run between 2 and 5% in annual increases. So you'll have some flexibility, but compared to other options, this is very stable. And then more specifically to the stop loss, the way it's set up is you have individual stop loss, which is got a visual that should help. Great, so if you look up here, so the 75,000 is called the individual specific deductible, so the individual stop loss. In your case, it's 100,000. So what we're saying there is any individual, let's say that woman, we'll call her Jane, is 110,000 in claims, or 150,000, whichever. Any claims that are above that $100,000 deductible is fully covered by the stop loss carrier. And that's unlimited for the policy period, that's unlimited for the lifetime of the member.
Who carries that again? The stop loss?
It's US Fire. Yeah, so.
So we're insured against those kinds of extraordinary expenses.
Yeah, you're insured against the worst possibilities that could happen.
Forever?
But
So as long as you're in the policy, is that what you just said?
Yeah, so for the
annual and renews, it's as long as we're in the policy?
Yeah, so if the policy is 1 year, so if you have somebody who's got a spec hit within that year, it's unlimited payout.
Just for the year?
For the year, now it depends on the contract and how you structure it. Like if you wanted to put in a no new laser provision, which, I mean, you could do that, then that would mean that there's no new, I didn't explain lasers, I'm sorry. There's no risk of them saying, hey, we don't want to cover, or we need to allow extra deductible for the individual.
Yeah.
Yeah.
It's an insurance policy, that's all. And the premiums could change year to year for that.
Yes.
I think that's what we need, so.
Max out of
It's an
pocket, is
insurance.
that another way of saying it?
No, max out of pocket has to do with plan design. So that's employee.
The program is heavily dependent on administration, the analytics, and you guys do all that? How does that work?
Oh, yeah.
How much does Valerie have to do?
Hopefully as little as possible. No, but to be more direct, yeah, we do essentially everything for the plan. And on the analytics side, we have a proprietary platform. It is the only one in the industry that can do this, where we are not only repricing the claims, but we are actually integrated with about 25 different stop loss markets, we call them, that would be carriers. And they're on the back end of it. So when we're shopping stop loss, they're able to get all the data that we have, which is important because it means more efficient underwriting, more accurate underwriting. It also means quicker underwriting, so we can turn things around in a matter of days as opposed to months. And so when we're working with them, let's say they have a concern about a particular member, I used ESRD as an example before, we're gonna immediately take that, negotiate, look for a program that works to offset that risk, and then make the recommendation to Roxbury as to whether or not you wanna move forward with that. Sometimes you wanna take the risk, sometimes you wanna implement a program, all depends on the particular instance.
Who's talking to our employees on a day-to-day basis?
That'd be Meridian Health.
Okay. They have a call center?
Oh, yeah. Yeah, full call center, so they'll be your day-to-day member support. We'll be an additional support on top of that, so if there's anything that needs to be escalated, Roxbury, Valerie and whoever else would come through us. We're more of the employee-facing support, and then Meridian is that member-based. Meridian's also processing the claims. They're billing any retirees that have contributions, and so they're doing all of those things that nobody wants to really get involved in. And then you also have we call it aggregate coverage. So your claims that don't apply to the spec deductible, which would be in this bucket here, people who have $100 in claims, $1,000, etc., they all come together so that you also max out additionally on that. These are just the current plan designs, which we matched exactly. These are a look at the rates, which you can see a pretty dramatic difference compared to the current. And a massive difference compared to the 2026 rates. I think the best way to look at these would be also at the employee level. So here's a few examples. NJ Direct 15 has the most enrollment, so I use that as the plan. You look at single coverage here with an employee making on average $60,000 a year. The current employee contribution is $4,700. With our plan, that would reduce, and these are approximate numbers, reduce by about 850, so the employee would save $850, and their contribution would go down to about 3,800.
Contribution is based on a percentage, actually.
Oh yeah, it's based on the percentage, so it's based off of, obviously,
Yeah.
chapter 78.
This is the average you're showing us?
Yeah, this is the average because, you see, we'll get the exact tier numbers after this, we just have to finalize the stop loss. And then you'll have the exact tiers for all of the offerings. But this is based off of that, I actually used 18% to be a little more conservative, but off of that reduction. So there's a couple of examples here. You see for family coverage, $60,000 a year employee, paying about $1,400 less off the 17% contribution. And to look at police officers, use $95,000 as the average salary, NJ Direct 15 family coverage, they're paying about $1,900 less annually with our proposal. So that's essentially it in a nutshell.
You say 1,900, just make me understand that. There's this hospitalization, doctor course, there's also your prescription drug, other health. Where's that $1,900 coming off of? Is it the combination of all that, some of it? Where are you finding these reductions as compared to what we have today?
Yeah, it's coming from the overall model. So I mentioned before the conflicts of interest with the PBMs, the lack of monitoring ability right now. So you won't be able to attack, like with current arrangement, you can't take proactive action on claims. So we'll be able to, for one, when you can see what's happening, and because of the program that we're recommending PBM, we'll be able to manage costs by sourcing drugs at a lower price. We'll be able to provide better strategic advice. And then because you're moving to self-funded the first year, you do typically see that savings. Part of that's claims lag, but part of it is also more efficient model. So the $1,900 is the employee's cut of that reduction in the premium, which is based off of the max cost of $4.5 million.
So it's my understanding that this plan kind of plugs up all of the leaks that bring our premiums so high. So we'll be able to monitor conditions without any of our employees being in danger of saying, well, you can't be covered anymore because of this condition. You're just going to monitor it to give them the best, most effective, cost-effective treatments. Is that what I'm kind of getting at?
Yeah, that's a great way to describe it. I would also say, what we're gonna do on a quarterly basis, if we wanted to meet monthly toward the end of the year when things are ramping up, we're gonna show Roxbury all of the options available to you. And ultimately, we call it a most advanced yet acceptable approach. If you tell us, yes, we would like to do that because we think that's good for our employees and we think they'll like it, respond to it, whatever, then you can implement that solution. We're never gonna push a solution on you, which is critical. Same thing with the employees, because it's all about access to care. If you have proper access to care with a proper network, and you have the additional solutions behind you, then you'll be able to manage costs and your people will be healthier.
Excellent. And again, you'll be able to search out the most cost-effective medication for those employees. That's also what I'm kind of getting at. Like they're really expensive biologics that some people do, and you mentioned dialysis, and so I'm hearing you guys are gonna find the best course for these people.
That's exactly right, and I can give you a better example. So if you look at the Aon rate report for the state benefit plan, they don't mention a lot of drugs in there. They really should, because I know there's many more cost drivers than this. But they do call out Stelara, they call out Humira, they call out, I forget what the other drug
Again,
is.
these are biologics
Right,
that I'm thinking about.
Exactly.
Yes.
So this is what we do. This is the most common program to address that. Those drugs usually have manufacturer's assistance programs, patient assistance programs.
Yes.
There are also federal and state level programs. And then you'd be surprised, Good Samaritan donor programs for people who are on those drugs. So we don't have this included in the current quote. We'll discuss it, next year when we can show it with the data. But one option would be you have the members go through this program. We manage the application process for the different programs. It's based strictly off of the financial cost of the drug and the member. which unless you're making $1 million a year, you're gonna get aid for $150,000, $200,000 a year drug. The average savings is 54% of that cost. The max savings we see is 70%. And we do two things. We look at the savings for the program, and we also look at the rebate. Because sometimes it really is important.
Very much.
But think about it, sometimes it's important, if you are getting a higher rebate and it's offsetting, you're looking at the lowest net cost of the drug, then maybe you wanna stay on it. Most of the time, I mean, not stay on it, maybe you wanna keep going through the current funding arrangement. But most of the time, we find that the alternative funding program is worth doing, even net of rebates.
Thank you.
Anthony, I guess where I'm a little confused, when you say that you look at it and you evaluate it, you're putting together for us a number of programs that are already out there. You're not customizing a program, so if, and tell me if I'm wrong, but Prime Therapeutics has a program, you're saying that's the right one for us. At some point in time, if you look at the list of drugs that the employees are taking, not the right one, you're gonna find another standard program to replace Prime Therapeutics. You're not gonna go in and make a brand new program.
No, we're not gonna craft
So your
everything.
goal is really to take Aetna, the UHC, Medicare, Maritime, and say, putting these pieces together gets you what you want. If we see later on that we wanna add something else to it, or one of them's not working, we're gonna try to find a better program for that. Different from the state health is you don't have all the baggage of the last 4 or 5 years, and all the other people. That's the risk we're taking. And the stop loss is what protects us in that loss.
That's correct.
Am I reading that?
That's pretty much spot on. I would say with us, where we're very different, and so most of the time, I don't work directly with clients. I work through, I would say 95% of the time, I'm working through brokers and consultants because we're so specialized.
Right.
And then occasionally we do work like this with townships and so on. We have 170 pre-integrated vendor partners, TPAs, PBMs, cost containment solutions. And part of our company, we have 75 employees. 10 employees are dedicated strictly to evaluating, reevaluating, and looking for new solutions on a constant, ongoing basis.
So you picked Aetna because you felt that from the data that you got from Valerie, that would be the closest program that would fit what we're looking for, without having a whole lot of data, because you don't have the data yet from the state.
Yeah, that's correct. Yeah, and then next year when we have the data, we'll be able to show you specifically which network you wanna go at.
Excellent. We can fine tune it next year.
Anthony, this is also for Valerie too. Valerie, you did say you vetted this with some of our union employees. Can Valerie join us?
Sure.
That'd be great.
You want feedback from the unions?
I wanna know what they said. Give us an idea of their reaction to
The feedback was all positive. Most of them were just, the biggest concern was the doctors. Is my doctor gonna be in network?
Right.
And then, so that's why the next day after Anthony met with them, he provided us the link to the Aetna network, which had all the doctors, that were there, and they were able to go in and see if their doctors were there. Now, you have to remember too, that our plan, which has out-of-network, availability also. So if your doctor is not in the Aetna network, you're still covered. You're still covered for, you have to pay a certain percentage of it.
Yeah, so
Right.
that's another way
So it's the same, even if your
achieve a
doctor's
savings,
not, even
is
if your
that-
doctor's not in there,
Right.
you're still covered. It's just, depending on if you're 10 or 15, it's a 20 or 30% coverage.
So there's another area where we get a savings.
Right,
The other
I
thing-
didn't get any negative feedback from any of the unions.
Yeah.
Like I said, the only concern was the doctors in the network.
Yeah, Mayor,
Yeah, please.
Go ahead.
I got here in September, jumped on with your team, specifically those areas of your union contracts require.
Can you get on the microphone so everybody can hear you?
Your
So I can hear you.
your union contracts require equal or comparable, so that was the reason we had all the meetings with the unions.
Right.
So that you don't have that issue, and they match.
And we don't have that
apples
issue,
for
is that
apples.
what you're saying? Yeah.
Being somewhat familiar with insurance funds,
Right.
and sat on 3 as a commissioner for 3 different funds, and I was also a commissioner on the state level.
Yeah.
So I went through a learning curve for a couple of decades on material.
My eyes are already bleeding just
I
thinking
did-
about that.
I did work for your staff, they were on top of that, and I did recommend the, third party, always like a third party opinion.
Yeah.
To review the plan, which
Right.
they did, it was a firm I did know, and they came in and looked at that also.
Excellent, very well. Valerie, another question. Well, the one issue for me, Mayor, if you don't mind, is the call center. I'd like, have you done any due diligence on the call center?
I did a little bit of due diligence,
Yeah.
they're a very well-known company.
Yeah,
I had the same concern.
yeah,
They're very broadly known and he has mentioned that, you know, they're owned by Aetna, so it's not like it's, you know, a third party coming in and doing it, it's a company owned by Aetna.
okay.
Yeah, I would also add, about half of our clients nationally use Veritain Health.
Okay, yeah, so that's important,
Yes.
and you're comfortable with that, and our retirees will then have to transition to, an Advantage plan.
The ones on Medicaid. will have to
Medicare?
Medicare.
Medicare,
I
right,
do all
okay.
the time.
So-
The ones on Medicare
That's
will have to
okay.
transition.
Yeah, I'm already, don't help me get more. You have Medicare, so they're on Medicare now, what do they have? They have choices now on Medicare?
Right now, they have Aetna, through the New Jersey State Health Benefits Plan,
Okay,
so they're already in Aetna,
yeah, is that an Advantage plan, or is it?
it's the Aetna Advantage Plan.
So they're in Advantage plans now?
Yes.
They just have to transition to?
They just have to transition to that, yes.
And is that something we can do without, what?
Well, once they're in motion for this plan, they'll be notified to transition over.
Okay,
It's not a complicated process.
yeah. Great, thanks.
Good?
Yeah.
Any other questions? Anyone?
I'm good.
Fred?
Yeah.
Very good.
Yeah.
Thank you, gentlemen, for the very detailed information and thank you, Valerie and Ken, for coming here tonight. Making sure our staff is well taken care of. Thank you.
Thank you.
And Anthony, thanks for coming in personally, to make sure we're getting taken care of.
Yeah, because
Appreciate it.
you don't talk to a lot of clients.
95%.
What's that?
You don't talk to a lot of clients, you said, so.
I know, I was
particularly
I was
honored.
half thinking as I was saying that, I was like, I really shouldn't say this. Just like, you know, the funny thing too, I said this at a meeting recently, I said, you know, I could be a much richer man if I were just like everybody else. We're kind of transparent to a fault, but that's just the way I am. I mean, to me, like I think I may have mentioned to you at some point, maybe, you know, in conversation with others, I come from a public sector family. My father's a county retiree. My grandfather was a cop. So, you know, I see what they're paying now, and honestly, it kind of makes me sick. So whatever I can do to help, I'm happy to do it.
Plus, you're the next town over, we know where to find you.
Yeah. To John Court, come get me.
And believe me, I've asked him many questions, and he's answered every single one of them. And I have a few things that I'll share with you also, after this meeting, that he's come back and answered as well, so. We take a very good, well-informed
Except from today.
Yes.
Oh, I provided that.
Oh, you did?
Yep.
Okay. All right.
Thank you, gentlemen.
Thank you.
Thanks. I'm gonna continue as they clean up, yeah, Valerie, do you need to review anything further with us?
No, I don't think so, unless anybody has any further questions for us.
But how about just next steps, if you wouldn't mind?
Yeah, Valerie, could you describe next steps
Yeah.
for the township?
Next steps for the township?
Yeah.
As far as like moving away from.
Should we move forward
Yes.
with that? I'm not asking, I'm saying should.
Yes. I think that the next step is, first we have to give state health benefits 60 days notice. So the next meeting will have a resolution moving out of state health benefits. They're gonna come in and help if we choose Nova. They're gonna come in and help with the re-enrollment, because this happens fairly quickly. It is open enrollment now, so, they would come in and transition that all over and help us with that, and then we just roll over into the plan. I mean, I do have 2 contracts I have to have Tony review, do a resolution, awarding them the contract for the healthcare. I plan on doing it as an exception to the bidding. And it's the proprietary, I can't remember the name of the acronym, but it's the.
Tony
Whatever you need. So I've looked at everything, and I think we're at a point now where we can make a decision. And I provided you all the HIP proposal as well. EUS, I'm gonna procure it as an EUS, it just came to me. So you'll see all that.
So I think all of us do agree, unless anyone else disagrees.
We're not in
Are we
agreement.
gonna have a further discussion, yes, the other options, or are we just making a decision?
No, we can have further stuff right now. But we should give Valerie some direction.
Yeah, we put this in our next meeting.
Go ahead.
Maybe we want to have a either a closed session to discuss the contract and the other options, or another meeting, but they're gonna need a decision.
Yeah, but there are really options on the table, are there?
I stepped into this in September when I got here, and worked with your staff. I reviewed this proposal also, and
I can tell you, normally I would not wanna take this step, after what the state plan's done over the last couple of years, and what they're proposing for next year, 37%, it's just mind-boggling. I don't see how we get hurt, any way, shape, or
a
form.
lot of towns are going through that,
Yeah,
and
this is our escape, our rescue to get out of.
I believe we can give Valerie, steps to move forward,
Okay.
procuring this, with over here, and,
To Fred's point though, what we're asking Valerie to do is move forward, put together a resolution that we can consider,
Yes.
right? So that's what we're really doing.
Yep. It'll be, for you at the next meeting, October 28th.
Thank you.
sure this was the easiest meeting you had all day.
Yeah, maybe second easiest.
Alright, any other discussion on this?
Yeah.
Good.
I'm good.
This brings us to approval of minutes, September 30th, 2025.
I'll move the September 30th minutes.
Any discussion? Roll call.
Councilwoman Albrecht.
Yes.
Councilman Carey.
Yes.
Deputy Mayor Crowley.
Yes,
Councilman DiFilippo.
Yes.
Councilman Hall.
Yes.
Councilman Riley.
Yes.
Mayor Patillo.
Yes, this brings us next to our first public portion. Does anybody in the public wish to be heard on any topic? Please come to the microphone, state your name and address for the record. Seeing none, that flows public. Report of council's liaison, representatives, council committee, new and old business. I have a couple things, real light things. I had the privilege of attending the Yom Kippur service at Temple Shalom last week, or 2 weeks ago now, and delivered a message of unity amongst our community. And on the tail of that, I'd like to just express how grateful I am that the last remaining 20 hostages have been released and returned to their homes. It's a great step in the correct direction in that part of the world. What was that? Absolutely. Last night, we had Lake Apaca Commission. Tomorrow, I have Lake Muscanaca Regional Planning Board, so I'll report back on that. And then, Fred, are you gonna touch on our meeting tonight, the grant meeting?
Yes, I will.
All right, and then the last thing I have is, clean communities. We do, Roxbury does a great job twice a year. Our Fall Clean Communities Day is October 25th, if anybody's interested in helping out and, continuing to clean up Roxbury Township, please reach out to Kellyanne Keys, and she will assign you a position. That's all I have. Thank you, Deputy Mayor.
thank you, Mayor. I'm just gonna touch real quick on the Lake Apaca Commission. They reported last night that they, pulled 1,682 cubic yards of weeds out, which is double what they did last year. That took out about 760 pounds of phosphorus, 16,000 pounds of nitrogen. in the discussion, what's going on is that the lake's getting cleaner, the water's getting clearer because of the application of many things, including alum. When it's clear, it makes the weeds grow. So, you know, it sounds kind of strange. So that we don't get the harmful habs, we get weeds. So we're getting more and more weeds. So it's a good thing to get some more weeds. The other thing that came up that Princeton Hydro talked about is that there's a federal HAB funding that they're looking at for dredging. And the idea is to allow that dredging to pull some of the phosphorus stuff out the federal government would support. That may help us down the road with landing channel. And that's what was very interesting last night, is talking a little bit about landing channel. As you all know, the water's down low. A lot of people getting stuck with their boats for the short season this year. And the constant rhetoric about always allowing the 12.5 CPM come across the spillway. And that's all I have.
Thank you. Councilman Albrecht?
Thank you, Mayor. I was actually able to spend the weekend going to various libraries around the county judging 4-H window displays. So that was a lot of fun in the rain. It's amazing seeing what these 4-Hers can do. And also last Thursday, thank you to Bob DiFilippo, I was awarded and collected my Roxbury Distinguished Alumni Award. So, sorry to miss your fundraiser, but
Congrats.
Oh, and another fun fact, I officiated wedding number 51 and 52. It was a double header last week. One at 2 o'clock, one at 3. And that's all I have, thank you.
Councilman Hall?
Couple things, Mayor. The township received the ANJAC Environmental Achievement Award at Rutgers University on Friday. I was happy to get down with Jackie, my fellow, to receive that. So, very, very nice award. This is for the work that was done at the Black River Park. Big thanks to Public Works, who's out there tonight, and to the Roxbury Rotary, and also to RHA, and of course the Roxbury Environmental Commission for getting that done. Very nice award given to the township. There was a lot of applicants, and we did receive it, so congratulations on that. We did have an environmental commission meeting last Thursday. We're still in the process of receiving the RFQ responses for the forestry plan. So once we receive that, we'll be able to send that information over to the Highlands. As I told you before, the Highlands has stated in the past that they would fund this for the township. Third thing I have is we had a recreation advisory meeting last Tuesday. We went over the 2026 fee schedule. Everything is pretty much in order for council's review, so you can expect to see that, in the next couple of meetings.
I'm gonna ask them if you guys have a presentation on the 28th, right?
Sure. That works out pretty well. Okay, and as the mayor had mentioned, we had a meeting today. Steve was there. Valerie was there, Mayor, myself. We met with the DEP in regards to potentially receiving funding for Imagination Station. The purpose of the meeting is to see if there's any changes to our submission that we require for a successful bid. It was a very good meeting. We learned a lot during that meeting, and the person from the NJDEP was extremely helpful. One thing we learned is we need to obtain some public communication options along with that bid. The bid is due by, I believe, February of 2026. And I know this question is going to be asked, so I'm just going to answer right now. If in fact we're awarded, we'd be awarded next summer, and that award would be good for 2 years. So if we were awarded July of 2026, that funding would still be available through July of 2028. So lots more to come on this, and this isn't the only, grant that we're looking at. There are several others that we're gonna be going after too. So, lots of good work in that area. Mayor, anything else you wanna add on that?
No, I think you covered most of it.
Okay.
More to come on that.
Yeah, more to come. I'm sure somewhere along the line over the last couple of weeks, we had another affordable housing meeting, so I'll let Bob and, Jim jump in on that. But, that's pretty much it. Thank you, Mayor.
Thank you. Councilman Riley?
I refuse to talk about affordable housing anymore. Anthony, did you find out if, we have 4 objectors or just the 3?
Yes, I was. So you have
Fair share.
Fair Share,
Avalon.
Salmon, Avalon, and, what? So it's 4.
But Salmon wasn't.
Salmon is an objector.
They consider themselves passive objectors of some kind.
Whether it's passive,
There's no
active, there's no distinction for
We're being
an objector.
Got it.
And they
And their
weren't,
attorney was on,
and they weren't added in after the fact because we were told
no,
that affordable housing needed that they had not, didn't object.
no,
That's it.
and their attorney was on the conference call, so.
The saga continues.
Well, then something probably wasn't really corrected because we should have had a master plan meeting with them 2 weeks ago.
I can only tell you how it transpired.
Okay, thanks. The only other thing I have is, marching band.
Yay.
Playing twice this weekend. Once Friday night football game, it's the one time of the year that they do it at the football game. That's Friday night. So you go watch the amazing 5-2 Gales, amazingly 5-2 Gales. Particularly when you're on field goal.
You might see the mayor pushing Danny.
Yeah, well, along with me, so. And then, they have a competition on Saturday. Nothing further. Thank you.
Councilman DeFilippo?
Thank you, Mayor. That's all you had about the band, really? I'm disappointed. We're gonna talk a lot more about this in the coming weeks and months, but, the safety of people who walk and ride bicycles and, in a lot of cases, use wheelchairs on the roads, need us to be more careful. And one of the things I think that we've talked to the chief about a little bit is, the necessity of giving those people who use our roads that are not cars 4 feet of clearance on each road. There are so many people walking and riding on the roads right now because of the weather. It's beautiful, and it's a beautiful time to be out on the roads. I think it's just important that we get the word out that it's not, we're not asking, it's actually a requirement that cars give walkers and people in wheelchairs as well as bicycles 4-foot clearance, which in some cases may mean you have to stop to let another car pass. So that's just the beginning, though, I think, of what the town needs to be thinking about, and we've talked about this before, in terms of making it safer for people not using cars to use our roads. And to that end, I know that we are taking into consideration a number of different proposals, and I think time is now to do that. So, but for the time being, it's I think very important that people slow down a little bit and remember that they're required to give 4-foot clearance to walkers, people in wheelchairs, and bicycles. That's all I have, Mayor. Thank you.
Is there a state law for first responders on the side of the road too?
This is similar to when you have to
Move
shift
over,
lanes.
Move over.
There's a move over law for first responders on the side of the road.
Right.
Councilman Carey?
Thank you.
Mr. Mayor, Board of Education had their meeting last night. Dr. Santoro presented the results of the student learning assessment for 2025. So if you'd like to see the results from that, the YouTube video is available. Let's see, we have a new principal for Lincoln Roosevelt High School, which would be Mr. Ryan Bartle, as well as a new Board of Education Assistant Business Administrator, Vivian Williams, who started on September the 22nd. Let's see, this Thursday, we have Roxbury High School doing Broadway Nights. And at that will be a preview of the play, I believe, is Good Man Charlie Brown, which will be October 31st, November 1st, and tickets are available online. Lastly, the coffee and conversation with the superintendent will be October 29th.
Do you know where?
No, they did not state, but I'm sure it'll be on the website.
I'll let you know, I get a text every time it happens. Anything else?
That's it.
Thank you.
Lastly, the welcome sign to Roxbury Township. That's on Hillside Ave, coming from Flanders to Roxbury. It's not there anymore.
Has it been taken down, Steve, for any reason?
No, it wasn't.
I believe it was just a sign that said Roxbury Township, welcome to Roxbury Township, or Roxbury Township established. Yeah, before you hit Nyma.
Yeah, but it wasn't a yard sign, it was an actual logo.
No, it was a blue sign, yep.
Let's take a look at it. Maybe it's knocked down, the car went over, it's just laid down. Or it's in someone's backyard. Okay. Madam Clerk?
Nothing, thank you.
Fred, I'm sorry. Fred?
Yeah, just one thing I forgot to mention, and then Steve, you can jump in, but I had a chance to go past Kiwanis Park the other day. It looks like it's been leveled, and it looks like you're on target for the work you need to do prior to the winter, correct?
Yes. Yeah, the timeline that I gave in the memo about a month and a half ago, 2 months ago, we're still on target there. We've demoed the old materials, we're working on the drainage portion now, and then soon thereafter, we've set up with the contractor, just waiting on a date for paving, and the ball's still rolling there, so.
Yeah, nice job.
We're moving along that side.
Thank you. Joe?
Mayor, council, briefly, I've managed to go through all your contracts that are sitting. I've gone through the pending files, which were numerous, in an effort to be able to go through them easier. I've put them on an Excel spreadsheet with the date it was initiated, whatever the issue is, and made the phone calls to department heads, vendors, and some of the legal counsel, so we can move those projects for you. So an Excel spreadsheet would be a lot easier to follow, to make sure they don't get lost in the mix.
Thank you, Joe.
Thank you.
That's the entire movement. And obviously I was on with your finance team on that mental health benefits project and your budget.
Joe, you mentioned that got independent review. Could you talk a little bit more about that?
Yes, I reached out for a firm that I had worked with before. I asked Val to reach out for them also. I reached out for the, for lack of better terms, the executive president of the firm, and asked them to do an independent review of the three, we're all experts, but I'm not an expert in that either. And they did do an independent review for me. Gave all that to Val. There was no charge for it. Past history.
Thank you.
You're welcome. I think it was important.
Value added, right?
I think you needed that, it's almost like a third doctor's opinion.
Yeah, no, I'm very interested in hearing about this, and I'm looking at Mr. Hall, and I'm saying to myself, is there a written report of some sort that we can look at?
I did do my due diligence. We'll get the communication from him.
Between now and the time that we have
I'll send it to you.
Would you mind that? That would be great.
Not at all. And, I did do some additional due diligence through the International City Managers Association.
Yeah, anything you can do that,
And obviously, I didn't finish, I I've read it before, but, I would recommend it also.
Feedback's been positive so far?
Yeah, and
Okay.
he's recommending.
You're recommending it as
Yes.
well?
Yeah, why don't you
Yes.
include that in the memo, and I would love to see that recommendation if you want.
No problem at all.
Super, John.
Thank you.
Thank you.
Everything well? Thank you. Matters requested referred by council members, managers, attorney, and clerk.
Move 8A.
A second. All in favor?
Aye.
That brings us, introduction of proposed ordinance 13-25, an ordinance amending the revised general ordinance of the Township of Roxbury to revise land use application and review fees and procedures for managing escrow accounts.
I'll move 1325 for introduction,
And the second reading would be
so the board secretary doesn't yell at me.
And I'll second it.
Alright, so we have a motion and a second on the second reading on the 18th. Any discussion on this? Seeing none, roll call.
Councilwoman Albrecht.
Yes.
Councilman Carey.
Yes.
Deputy Mayor Crowley.
Yes.
Councilman DeFilippo.
Yes.
Councilman Hall.
Yes.
Councilman Riley.
Yes.
Mayor Patillo.
Yes, hearing and adoption of ordinances on second reading, there are none. Introduction and adoption of resolutions.
Mayor, I'll move 2025-0-290 to include 2025, 291 through 2025-297.
I'll second.
Any discussion? Seeing none, roll call.
Councilwoman Albrecht. Councilman Carey.
Yes.
Deputy Mayor Crowley.
Yes.
Councilman DeFilippo.
Yes.
Councilman Hall.
Yes.
Councilman Riley.
Yes.
Mayor Patillo.
Yes. That brings us to personnel change, there are none. 13 communications, October 10th, 2025. I have one, you have some?
Yeah.
Okay.
Number 2 on the list is the, Dumont settlement with some provisions of limiting our ability to sue later. Which the, MSA has taken a position against. Tony, where are we
Yes.
with that? What can we do? How can we, double down?
I mean, the only thing you can do is, potentially, a resolution opposing it and sending it in, but the comment period is closed at this point. I mean, almost every organization has objected to this, so, adding another layer, I don't
Okay.
know. I don't know
Well,
if it's-
that's-
yeah.
It was just disturbing that the state would even think about settling that way, leaving it open to, closing the loophole for DuPont and leaving us liable for any possible excesses. Ridiculous.
I'll keep my comments to myself tonight.
Tonight, yeah. I'll call you later.
Any other comments? I have one on item 1. So item 1 corresponds from the DOT. I just wanted to give a little background story on this. Back in July of 2023, council, we reached out to the DOT to ask them to reevaluate the jug handle at Drake's. We asked them again in 2024, so in 2025, at the end of 2025, finally getting a letter saying that they acknowledge it needs to be worked on, is a step in the right direction. I'm happy that we were able to accomplish that after 26 months of asking. So jug handle and cliffs should be widened eventually. Alright. That brings us to our second public portion. Does anybody in the public wish to be heard on any topic? Please come to the microphone, state your name and address for the record. Seeing none, I close public. Do we have an executive?
Very quick executive.
Oh, you said that every week.
Just need a card for one small thing. What is it?
One small thing.
It would be litigation,
We've heard that before.
it would be litigation,
Okay.
tax appeals.
Tax appeals. Litigation, tax appeals.
A resolution of the Township Council of the Township of Roxbury in the County of Morris, New Jersey, of the authorizing conference of the Township Council with the public excluded Whereas it is deemed appropriate that the Township Council discuss the matters hereinafter mentioned without the presence of the public in accordance with the provisions of RS 10:4-12B, being Section B of the Open Public Meetings Act. Now therefore be it resolved by the Township Council of the Township of Roxbury, matters relating to litigation, tax appeals shall be discussed by the Township Council without the presence of the public.
All in favor? All right, folks, we're gonna go into executive. You're more than welcome to stay. We will not be taking any action in executive. We should be back in a quick one, according to council. When we come back, we do not anticipate taking any further action.
See?